Okay, so this was a case we did I did last week. This was an 82 years age. This was an 81 years age gentleman with Canadian frailty class 5. He was hypertensive, presented to us with dyspnea on minimal exertion for last 6 months. His exam was normal. There was labs were normal, just there was some LV strain pattern in ECG. This is his echo. As we can see that the EF is preserved. There is some LVH as well. There is some diastolic dysfunction. Transmitral flow pro velocity is around 40 centimeter per second. So we did his MPI scan, and it actually shows the ischemia in the territory of LAD, as one can see here. In apical and mid apical and apical and mid septal area, and the total ischemia burden was around 12%. So we did his angiogram. Here we can see the left side seems pretty normal. There is some disease in distal course, otherwise okay. So here is the picture after the ballooning. It's a good size vessel. So we did our first stent from the distal mid to the mid course. It was 2.75 38 DES. Post dilated it with the 315 non-compliant. Okay, as one can see that there is some competitive flow distally from the RCA, so that's why we are not able to see any flow in the distal LAD. But after the second stent we can see that as. So this is our stent deployment for the second actually we did the LAD ostial nailing in here. So here we can see that this was just sorry, this is not working. Okay, now it's working. Sorry, काम नहीं कर रहा. अच्छा नहीं, ये आगे नहीं हो रहा. Okay. So after the proximal stent deployment we did the 3.2515 NC, and the result was pretty decent. Here is the final result. As we can see, after the final stent deployment, there is a good flow distally as well, which was not evident from the first stent. After my patient was discharged on second day, doing wonderful ever since, and functional class improved tremendously. Thank you.